I'm sure most of you are familiar with what Entonox is, but some people might not be aware of the impact that it has on the environment. It's significantly more impactful than standard carbon emissions. So it's 296 times more harmful than carbon. So this can be a really high source of emissions, particularly for organizations that use this, which are primarily the acute trusts and midwifery delivery areas in particular. And that can not only have a significant impact on the environment, but also on people's health. So there can be a real impact on individuals' health around, headaches, fatigue, as well as impact on B12 levels as well. So there's co-benefits to avoiding having Entonox leakage. So it's a key focus of the NHS targeting anesthetic gases and in particular nitrous oxide because of the significant impact it has. So we started looking at this back in 2021. And as you can see there, our anesthetic gas is made up a significant part of our emissions of around 17%. So it was a key area for us to focus on. When we then looked at that in detail as to how that was broken down across all of our gases at the Trust, we can see that our emissions from our maternity manifold in the midwifery department were contributing almost just over 80% of our total emissions. So 4,000 of the just over 5,500 tons that we emit annually were coming from Entonox. So we knew that was an area for us to look at. Following establishing that, we then, back then, Alifia Chakira was just starting with the nitrous oxide project. So we worked with Alifia on how do we set something up, what process should we adopt, and we set up a multidisciplinary team. So I'll touch on in a moment how Entonox is delivered for those people that are maybe not familiar with it, but we required involvement from a number of different areas of the organisation. These included our estates teams, our pharmacy teams who controlled the delivery and supply of Entonox, our midwives who were key in obviously delivering this to our patients, our PFI provider, they were the owner and operator of the building in which our maternity facility is housed, and myself from the sustainability team. So we then working through the nitrous oxide toolkit, which essentially starts from, working in the manifold area all the way through to the point of delivery in a kind of logical way. So in order to get the engagement of the team, it was key that we collected the data. Back then, the Greener NHS dashboard didn't exist. So for any of you that are not familiar with it, I'd definitely recommend going and registering and logging into the Greener NHS dashboard. This will now give you the figures that you need for your nitrous oxide emissions, your Entonox emissions, as well as the part of work that we did, which was then comparing it to births. The reason why that was important, it allowed us to then come up with a CO2 per birth figure, which we could then compare with other trusts. Back then, there were only a few around, but we found that we were already at that point around 4 times higher than other organizations that we had. So again, we knew we had an issue, and sharing this information with the relevant teams that we put together, they were all really engaged on the fact that we had an issue and what did we have to do to fix that and what was the process to go through. So I think definitely collecting information and sharing it with others really helps in that engagement process. So we started at the manifold and worked all the way through from that through our supply pipe work up to the bedhead units, where there's the probes or the demand valves, which are then actually plugged in to deliver the gas to the women in labour. So most of these we could do behind the scenes, but obviously the demand valve work did mean that we had to engage with both the midwifery teams, the PFI teams and the pharmacy teams to enable mobile cylinders to be brought in so we could come off the main manifold supply and do the tests whilst maintaining the availability of Entonox for women that were in labour. So to give people a little overview of what a manifold looks like in a large acute trust, we're fairly typical in that we have large G-size cylinders. This is what a manifold room looks like for those people that may not have ventured into a manifold room before. This is one half of our manifold room. This is the other half. It was a shame that we didn't have slightly neater numbers written on the walls, but they serve the purpose of what we need. Obviously, for those of you that are midwives or clinicians, you'll be familiar with bedhead units and demand valves that are used for administering Entonox. So what we found when we went through this process was that the manifold itself had no leaks there. We tested that using a soapy solution to check for leaks or bubbles. We then checked the supply pipework, and again, we had no leakage there, and we did some drop tests there. We then, when we went into the maternity department itself, and we coordinated to get some rooms where we could test and do drop tests on the bedhead units, we found that we did have some small amounts of leakage on some of the bedhead units, which required leakage. But the interesting thing that we found was, in order to do those tests to establish leakage on the bedhead units, was that they couldn't be carried out with the demand valves plugged into the terminal units themselves, because the rate of leakage from those demand valves was so great that we couldn't actually complete the test. So we knew then that we had an issue. And that was where we were really fortunate that we had one of our meetings to discuss Entonox that afternoon, and we worked with Julia, our lead midwife, and said, what is our process around these, which at the time was to leave these demand valves permanently plugged in 24/7, and said, could we just remove them when they're not in use? Which she said, absolutely, I've got a midwifery meeting this afternoon, we can start that from today. So that was fantastic for us timing wise, because we got to implement this change really quickly. And the impact that had was significant. So you can see here, this was our previous consumption. And then following that change, the dramatic fall that we saw. So when we first got this data, I was a little bit nervous because it was such a huge reduction. But it turned out the data was correct, and that really was the level of leakage that we were experiencing at the trust. I think it's worth just giving some context to this, that we obviously did have a high level of leakage to start with, so not everyone's going to be the same. But when we look at the Greener NHS dashboard, you can see there's an awful lot of trusts that are still at the level of consumption per birth that we were back in 2021. So there's definitely scope for other organisations that are going through this journey at the same time. So the result of this was an 87% reduction in carbon emissions from the Entonox delivered to our midwifery teams, which is around 347 tonnes a month, coming all the way down to 45. And there were a lot of additional benefits to this. So cylinders were getting exchanged every couple of days. Now that's every few weeks, meaning there's a lot less portering time. So there's a freed up labour. There was a saving of £40,000 cost saving. And as well, there's reduced emissions from all the transport from the vehicles that used to deliver cylinders to site. That's reduced significantly as well. So looking at this now, we can see that our emissions over the last couple of years have fallen significantly from where they were. We can see the part year effects in 2021 and then the full year effect in 2022, where we've gone from our peak of almost 4,500 tonnes of carbon emissions from Entonox down to 874 in the last financial year. This is the chart that you can take from the Greener NHS dashboard. We were looking really quite good up until the last couple of months, but you can see that we have had some level of increased leakage. One of the knock-on benefits of this work is that our portering team are now really engaged in this, and they actually carry out monthly checks of cylinder usage, and if any leaks are detected, they report them to the estates team and they get resolved much quicker. You can see we had a little leak back in June 2022. That was fixed quite quickly. Unfortunately, in both March and then again in May, we've actually had 2 faults on the system. So those faults have now been rectified, and our emissions back in June have now dropped back down to our normal level. So this isn't something that we can just do once. and there is still the potential for leakage to happen in other areas of the system. So these 2 leaks that we've had recently have been on the manifold side of the system, where previously we had none. So it's certainly something to that you need to keep on top of and check. So in summary, I think it's really important to collect that data. You won't be able to do this kind of work on your own. It needs the engagement of lots of people from different teams working together to achieve the goal, to understand the impact of doing one thing on one part of the system, how that will impact the others somewhere else further in the system. I think it's really important that we share this kind of data as well as the benefits, both internally and externally with other organizations. And getting that engagement internally, being able to carry out that leakage audit, it can be done at a fairly low cost. This piece of work for us only cost us a small amount of money from the PFI team for replacement of seals, which are done on their preventative maintenance annually as well. So it was a very low cost project, which delivered a huge environmental benefit and also a huge benefit to the staff and patients working in those areas, without impacting on the quality of clinical care that we're delivering at all. So this approach of ensuring that the demand valves are not left plugged into the bedheads has now been included in the national guidance around use of Entonox, and we're doing more work around Entonox usage within the NHS and pulling together some technical standards. But I think it's really important if we can share this, and I'm more than happy to chat with anyone outside of this meeting if people would like more detail on this, to share this work and help anyone with any queries that they may have. But it's quite a straightforward system that I think getting the right people involved can help everyone to ensure their systems are working as well as possible. And we do have future steps, which again, I'm more than happy to talk about our future plans around this and other areas if anyone would like. But thank you very much.